You had an example where you had a student in your class who was having symptoms and didn't really know what it was, and it couldn't get diagnosed. Nobody was really sure what it was, and the more you heard about it and the more you saw some of these other diseases being discovered in ticks, you actually put two and two together and suggested he get tested for this.
I think it sort of reinforces what we've been saying, that the culture is changing. The local health providers are learning that they have to think risk of tick-borne disease. One of the flow chart that healthcare providers use when they diagnose a patient, way up at the top of that flow chart is it a geographic location where there is a risk? And since we've just recently provided that information, it's not out there for everyone to see. So if they don't think that, the whole flow chart just kind of goes away. So because I know of the risk, this patient was ill, I knew of the disease, and I said, I think you have babesiosis, and it turns out that he did. So it was just my knowledge of the local risk that put that in motion, and he's doing great now.
Well done, Ms.
Yeah.
And it drove the point home.
It drove the point home.
You're having another event coming up next Wednesday on September 11th in Ticonderoga. Tell us about that. Much, again, raising awareness, sharing your information, sharing your knowledge, trying to get the word out.
So the health department organized this event and mirrored it. We spoke with the Waylandsburg Grange, who did the last event, and they were very happy to, let us use their model for this event. And so we've been doing all the media, social and print media outreach, and it's on our website. So really, really excited.
You're having another event coming up next Wednesday.
It's going to be at the Best Western in Ticonderoga, and it'll be from 7 to 9 p.m. on the 11th. And Leanne's going to speak regarding her tick-borne expertise. I will speak regarding public health and our role in prevention and education awareness and surveillance and investigation. And Dr. Collins, of course, is expertise with diagnosis and treatment. So we're excited. We've had a lot of interest, and from quite a few towns. So it's going to be a great event.
Do you think this is something that may happen on a more regular basis? Will you continue to do this in the spring and maybe fall of coming years?
We hope so, and the reason that spring and fall work really well is because spring is great awareness for when the nymph ticks are out, and then fall, of course, we have hunting season coming up and hiking. People like to get out in the fall, and that's when the adults are most prevalent. So we do hope to do this again next year.
And we're hoping, Susan represents Essex County, and I live in Franklin County, and the college I teach in is in Franklin County, and so I'm hoping that other counties might pick up on this and take the burden off of those folks and help in organizing. And I think probably Keith and I, and maybe Susan, would be happy to go to other counties. And
have you talked to Clinton or Franklin County health departments about the possibility of spreading this out more?
Not yet, but that's on my list.
Yeah. And I imagine there would be an interest.
We have shared this event in Ticonderoga with Warren County, Franklin County, and Clinton County public health directors. So they're aware that it's happening. There
was a discussion at Waylandsburg. You brought up a vet to talk a little bit.
The veterinarians.
Some people may wonder: are pets just as much at risk as humans from tick bites and getting these diseases?
Dogs are good sentinels for Lyme and other tick-borne diseases because their nature is to be out in the woods more than people. They cover more territory when you go out for a walk with your dog. And dogs are often tested more routinely than humans. So they are good sentinels, and we have seen that an increase in the rates of disease, tick-borne disease in dogs usually comes just before a surge of cases in humans.
Sure.
And does it have the same impact on dogs, or do they withstand?
With Lyme disease, many dogs remain asymptomatic. So not all dogs that test positive for Lyme will have gotten sick. And we don't really know if that's exactly the same as in humans or not. So dogs aren't always symptomatic. When they are, they're treated in the same way that humans are. Dogs do get anaplasmosis, and I know some veterinarians in Essex County have reported and communicated with us that they're seeing a large increase in anaplasmosis in dogs in that area as well.
For sure. The other thing is dogs also have the Lyme disease vaccine. So many of them are vaccinated and might, even if they do get the disease, because the vaccine's not 100% effective, may have a less severe disease because they have the vaccine on board. And with the anaplasmosis, I just wanted to mention that In our first case that we saw was 2015-16. We had 1 case. This year to date, in 2019, we have 41 cases.
Believe it.
So we went from 1 to 41 in just a few years.
That's
And
what we're doing too.
certainly the veterinarian said, yeah, we've
seeing
been
the
seeing
same-
it in
the same
dogs,
thing.
so they are a very valuable sentinel.
And in humans, what kind of symptoms are there? What does it do to humans?
I'll let you speak to that.
So just to clarify anaplasma, because I know people are going to wonder what this actually is, it's a bacterial infection that infects white blood cells. And so the infection is in the bloodstream because the white blood cells are in the bloodstream. So this is a bacteria that's carried by ticks, and it's transmitted by the tick bite, gets into the white blood cells, and makes you sick. And it's very similar symptoms, again, headache, fever, nausea. You look for things in the blood to see, and again, the exposure history is key to suspect it because they call it a flu-like illness. Even though I really don't like that term, I think it's more of a malaria-like illness, but not that many doctors are familiar with malaria, but it's basically headache, nausea, fever, muscle aches.
And eventually, do they go away, or is that something that could be lasting?
That's something that, you know, if you don't get treated, you can get better without treatment, but it's a 5% mortality. And everybody that has it should get treated. If they're diagnosed, they should be treated because it can be life-threatening.
And we're seeing it in what percentage of ticks?
It
Depends on the
sites-
area.
It depends on the area. I think on average, last fall, it was around 10% in this region.
Yes.
So an important distinction in the transmission is Lyme disease. The tick has to be, or is supposed to be attached for 24 to 48 hours. Anaplasma, the tick can be, transmitted with a lesser time of attachment, like 4 to 8 hours.
Yes.
And we haven't even talked about Powassan virus yet. And last fall, my students and I, as part of their senior project, looked to see if there was a risk of Powassan virus. And Powassan is a virus, and so it's not treated with antibiotics that would treat these other diseases. In fact, there's really no treatment for it other than supportive therapy. And it's fatal in maybe 10 to 20% of the
About
time.
10%, and
10%.
what is it? You can be on, is it, I don't want to misspeak, 8 minutes for Powassan?
15.
15.
Is
Yeah.
what
15.
is thought. So it's transmitted really quickly. And what we learned, deer are good sentinels for Powassan virus. We not only found it in ticks, we actually did find it in one site in the Adirondacks in the ticks that we collected. And that's kind of rare to actually find it there, in about 5%, which is high. But we found that on average about 40% of deer in this region have at least seen it, been bitten by a tick that had Powassan. So deer are very, very sensitive sentinels because deer can get bitten by thousands of ticks in their lifetime. If any one of them has Powassan virus, they won't get sick, but they will develop antibodies. So we're hoping to continue that. In some regions of the state, almost all deer show signs of Powassan. So it's no reason for great concern, but we do have a growing risk of Powassan virus
And you
here.
mentioned, Dr. Collins, that can be fatal, and there have been.
You can get an encephalitis, which infection of the brain, and that's how that one is fatal. Exactly. And there's really no treatment for it at this point in time.
Just before we move on to the prevention, you mentioned the vaccine. There was a human vaccine, but it was ineffective, and they're in the process of trying to develop a new one?
Yes, it was modestly effective. It wasn't great, but it did have some efficacy. But unfortunately, there were so many lawsuits placed against the company that made the vaccine that they withdrew it from the market. And we've been in that sort of problem, I think, ever since. People are afraid to have their vaccines come out. But they are, I think we're getting where we will maybe have one in the next couple of years.
And we talk about prevention. Obviously, when you go out in the woods, be prepared, dress accordingly, use DEET, take the steps to protect yourself. Are there other things that we can do?
So what our message is at the health department, exactly what you just said, Tom. And then when you come inside or when you're done in the woods, you shower, you bathe immediately and do a tick check. So you're basically checking, even using a mirror where you can look behind your back. We're actually finding our greatest number of people infected are 65 and older. And we're wondering if potentially it's because they are not thinking about it and they're not looking behind them and maybe, have spots on their bodies where they're not as in tune to the fact that they might be infected. So that tick check is really important. We're speaking with camps every year. We have messages to schools, healthcare providers. We have messages for hunters, for campers, for hikers. I showed you we have signs, trail signs, metal trail signs that are really important. We do a bathroom sign for, in the bathroom stall. and our social and print media. So, but we still have people that aren't aware, or their livelihood is potentially farming, where they're outside all day long. And unfortunately, they learn by getting the disease. They learn about prevention. That's not prevention. So we want to do whatever we can to get the word out through ECHO, through these conferences and trainings, through public airing, any way we can to increase awareness.
I think it's also important to understand the behavior of the ticks and where you're going to find them. Are you going to find them on a mowed lawn? Probably not, but anywhere there's leaf litter, deciduous forests, and also understanding the seasonality of them. Understanding that late May to early July is when the nymphs are out, and that's the greatest time for risk for people. The ticks are really small, and they seem to transmit the disease more frequently to humans. And then in the fall, it's around Columbus Day when the adults come up. And now the nymphs will be low in the understory. They don't climb more than 6 inches off the ground. So if you protect your ankles, apply bug spray, permethrin around your ankles, and catch them before they climb up to a higher spot on your body, you're going to protect yourself. They don't drop off from the trees. They don't jump. In the fall, they will climb up as high as waist high. So just sort of understanding that, knowing when you're in a area that probably has ticks, and understanding the times of year to be the most careful. Probably this time of year right now, early September, late August, is maybe one of the lowest risk times to encounter a tick. It seems kind of strange. It's still summer.
Right.
But you can, because they're dormant right now, the molt and the adults haven't hatched yet. But we know that people can get Lyme in January in the Adirondacks. If it's above 40 degrees, the adult ticks are hungry and they will be up trying to find a host. So the rest of the year is really still a high risk time.
And we talked during our forum back in June, our climate change forum, on how the impact that climate change is having on the Adirondacks. And this is certainly one of the things we're seeing is the tick population.
Expanding.
Again, as you mentioned, it's been around Lake Champlain for a number of years, but now it's getting into the high peaks. It's moving higher.
In more interior and up in higher elevations.
So
and
just because you're way up, don't think that the ticks
probably
aren't up there.
What we like to say is it's still patchy. All of the suitable habitat hasn't yet been filled in with ticks. So there are places where they probably can live now, and they just haven't found their way there yet because it's really new and emergent and moving. So it's patchy, but the risk is present throughout the park. The highest densities are at the lowest elevations. So we don't say there's zero risk anywhere, maybe the summit of Mount Marcy, but typically below 2,000 feet, but we have reports of ticks actually probably a little higher than 2,000 feet, and that's pretty high.